fault because he took the child seat out of the car so that he could get his bike in the back. Oh, we're live.
Fabulous. Excellent. Well, welcome back everybody to another weekly webinar from myself, Will, Carl. Hope you've all had a good week, and looks like we're going to have a hot weekend if it could get hotter than today. Right, guys, let's plough straight in. I believe somebody might be whisking themselves away for something nice to eat this evening. We're not jealous at all, and we don't want to be heckled with rumbling tummies.
Yeah, after a week of sort of hypoxia, like everybody else in their masks and shower curtains and everything else they're wearing. Got good news in that my daughter got a 2-1 from Bristol University.
Yay!
Fantastic!
Congratulations,
Chloe.
Well done, Chloe.
Yeah, so hence we're heading out for a bit of nosh.
I should think so. That's fantastic.
Just Eat or Deliveroo?
That doesn't exist anymore, does it? No.
It's Just Eat. I think they merged with Just Eat.
Did they?
Wimpy.
Not there are these things.
Probably sold it for a couple of billion, you know.
Yeah.
We got in the wrong business, didn't we?
Yeah. Certainly did.
So,
Right,
yeah, that's kind of my excitement. I was going to bring up the F word again, just when we thought we'd kind of left it all behind. I managed to see a document, I think, from Scottish Dentistry. Have you read that one?
Oh, I thought I'd let you do it.
Well, we can all chip in and like throw things at it and smash our computers up. Yeah,
it was. Well, my thoughts on. Go on. You've read it, mate. Did you want to say what you think?
There was only kind of. I think it was all about mitigation and stuff like that, wasn't it? Really.
Yeah.
And it was basically, I think it's like you make up your own rules based on your mitigation, but if you don't have virus machines and an open window and a certain square footage of room, once you've done your 40 minutes crown prep at 9 o'clock in the morning, you basically go home then because your surgery has to shut down for 6 hours. Did I get that right? Or
That's really
brilliant.
Yeah,
that's my kind of work.
One a day. If you do it at the beginning of the day, if you do it at the end of the day, then wow,
doesn't matter,
mate. Yeah, that's it.
Yeah, I quite like the idea of turning up at 9 o'clock and doing one crown prep and going home.
Is this just because we mentioned the potential Welsh fellow time? You're doing a one-upmanship here, Will?
We've gone north of the border. Yeah.
See, Wales didn't actually officially, well, as far as I'm aware, didn't bring that out. It was just kind of bended around. And then Scotland got wind of our webinar last week.
Yeah.
And they went, what can we do? Hang on a sec. Call her, call him, call that donkey over there, as in the one that's in that field. And they got together, and what they did is, because it's via Zoom meetings and not face-to-face in a boardroom, they all just got a bit confused about what they were talking about. And I think Dominic put it quite well, Dominic O'Hooley, where he said, they had different bits of information on how to make a horse, and they came up with a camel or something along those lines. I think he's right. You read it and you just think it just doesn't flow. It's almost like written by several different individuals that have come up with different conclusions, and then they've kind of made it up and gone, we'll advise that.
6 hours, that'll do.
Yeah.
What concerns me is that
all the dice.
About a month ago, you two were saying, coming back, it's more tiring than what I thought. So what I'm worried about is that next week you two were going to say, well, actually, one patient a day. It works.
That'd be nice.
I can manage it.
That would be nice.
As long as it's upper and lower full arch.
Yeah,
absolutely. Yeah,
that's okay.
Yeah.
So what else? How's your practice been this week, Will?
Again, super busy. I think last week I noticed for some reason Monday was the diary was clear, and then all the staff came up to me and were like, "We're just so busy, we need some time. You're right if we open up Monday?" And I just went, "No,
Oh, no.
no, just leave it. I've had whatever 4 or 5 weeks. Maybe it's my age. I don't know. It was literally like, I'm just got these masks that are cutting off the blood supply from my carotid arteries to my brain, and I'm not that I'm losing any weight in the shower curtain. Just water that gets sort of, sucked back in the minute I leave the surgery. But
Nice.
I should be about 6 stone by now. I don't know.
It's how kind of condensation works. So it's not, it's not actually coming out of your body as such. It's just that heat exchange. So it's just from that little bit of atmosphere between your body and the air. So all the air, all the moisture there, it's not from you, mate. You're just going to pile the pains on, I'm afraid.
I know.
Sounds me.
Tell me about it, especially tonight.
Yeah, with your Deliveroo.
With me Deliveroo.
McDonald's deliver now.
Yeah, of course they do. Well, what do you think we're having? I said, you can have anything on the menu, Chloe.
McDonald's.
Filet of fish and a quarter pounder with cheese.
Yeah, nice.
Large.
Ooh, super size, mate.
Can we bring you two back in the room? In the room. Food after.
Just a quick question while we're live. Have any of you seen wetsuits in your house lying around anywhere? It's
a bit neat.
I know it might sound a bit random, but I don't know.
On a Friday night, anything goes.
I don't know whether Kelly tunes into this, but I've spent the past week looking for the wetsuits because we're going away, and she swears blind that she didn't give them to the charity shop, but they're not anywhere to be found. Now, bearing in mind we've been in lockdown, so I'm kind of a little bit confused as to where they've gone. I might get crucified for this, actually. We are live, aren't we? This has been, I'll shut up now.
Can we cut that?
Right.
Yeah. Go and make her a gin.
Back in the room.
So, for a minute I thought this was some sort of new PPE that, it was like wearing a wetsuit in the surgery.
Possibly.
Oh, really? What I was going to talk about. No, I'm just talking random crap.
Oh, okay.
I did.
That's unusual, that is, Carl, actually.
It's because it's irritating me. It's on my mind. I'm sick of, it's one of those things where I've looked everywhere and I don't want to waste my time looking anymore if it's in a charity shop or if that guy that's nicking the cars is wearing the stuff or whatever.
Can I ask you a question, Carl?
Who, me? Yeah.
Yes. Have you been out in the sun today?
Only for a little bit.
Right. It might just answer a few questions Will and I have got.
I haven't got a baseball cap on. So
this week we've one of the practices we went into was outstanding, really, absolutely fantastic, lovely setup. It's a new practice. And a patient that we got talking to informed us that their dental practice still isn't open and no signs of it opening. So have you guys heard of many practices? And Will, I know you've taken on quite a few new patients. You've told us over the last few weeks. Is that still the case? Are you hearing that dental practices aren't open?
The feeling I'm getting is that the mixed practices are getting their NHS payments. I don't want to point the finger at anyone, but they may be getting their NHS payments and thinking, we'll just do private work. So I think some patients, possibly who've been NHS patients, may be getting sort of frozen out.
Yeah.
Because that NHS money is coming. So I think, possibly some practices are just diverting all their attention to private. Allegedly.
It confirms exactly what I've heard. So a few more than 4 consultations, but the 4 consultations that came in couldn't get in with their dentist because their dentist wasn't open, and they were all previous NHS patients that have been to see the private practitioners and then been referred to us for implants because they either had extractions or spaces that they wanted implants for. And they always did the same thing. I'm an NHS patient, or I was an NHS patient, can't get in to see the dentist because they're closed. So I came here because they're open and they were willing to see me. And it's what? They're not open yet. But then I thought, well, I don't want to point fingers like you said, Will, but I'm thinking, well, if you're getting paid, and
I think, yeah,
you're getting paid.
Incentive thing, isn't it? Possibly.
Yeah. Well, it's a bit like you on Mondays. If you don't want to open,
I'm not opening. That's it. Except I'm not getting paid for that.
No.
Not very bright of me, but
one of my favourite stories from this week was the chap that works at the BBC, and I got chatting to him, or he got chatting to me, and he was telling me that they've started filming again for the part that he works in, so he's sort of in part of the production side of things, and they've been trying to work out how they can get around the sort of social distancing, and they've got 2-meter bamboo canes that they use so that they can put it in between the actors or in between the people. I said, do you sharpen the end for people you don't like? And some of the people he was telling me were using these little laser pointers, so they actually point it, and they have that little 2-meter, you're 2 meters away. But the best bit was the intimacy parts. So they have a perspex screen when they're going in for the kiss, and in certain programs like EastEnders, they've got mannequins to make it look like the places are more crowded. Right. So you see the back of the mannequins and things like that. So if you look out for some of these sort of live programs like Coronation Street and EastEnders, you might notice that when they go for a kiss, it fogs up.
And their lips spread out on the perspex.
Yeah, like that. Without a screen.
I'll have to watch it.
You've really been in the sun, haven't you?
It's just getting to me. It's just like, I've had enough now.
I'm sure you two are both cynic, Carl. I know you certainly have. Well, I think it was last week. I'm really surprised of the colour of some of the face masks that people are wearing. Now, I don't mean they've gone and had it personalised I mean our standard, perhaps blue masks that are sort of brown around the ears, and today we're brown around the nose.
Yeah.
So, that was probably round, the first time this came round, I
think that's probably one of the things that hasn't been kind of discussed, is it really, that the masks sort of do become useless fairly quickly. So it goes back to the good old chat we were having right at the beginning. You're wearing these sort of masks sessionally, but they kind of stop their effectiveness after, a good sort of 15-20 minutes or so, and they start to degrade quite rapidly. But people obviously, they've got to pay for these things. Yeah. So the people that are in the public eye might not be aware of that. And so they're wearing them what seems to be consistently for weeks without changing or buying a new one.
I'm not hating to add, this was not clinicians, this was the general public, just to clarify. But still, that said, this is the colour of them as well. So even if somebody isn't aware,
it's a bit brown,
you shouldn't be, wearing them when there is a stain, that colour on the mask that shouldn't be there. I would like to think somebody would go, ooh.
It's possibly a theory that I don't.
No.
Are your practices giving them to patients when they come in?
It varies, actually, Will.
Yeah.
Last week they weren't, were they? One of the practices, the patients had to bring their own.
Yeah, I mean, I think they're all asked, a bit like the shops, really. They're all asked to bring their own, but if they haven't, then they're supplied. There hasn't, I haven't had any of the patients that we've seen complain about not wearing a mask. I know you did. So I haven't experienced that. And they've all been very compliant, to the point, actually, where some of them have been a bit nervous to actually take it off when they're in the surgery.
Yeah. I know. Shall I take this off? You can like.
Yeah.
I'm good, but not that good.
Yeah. Well, I just let them leave it on. It hasn't changed the way I work.
Scalpel straight through.
Yeah, straight through the mask.
Carry on, keep going.
Oh my God.
6 zeros. Non-resorbable.
Can you see those?
Not with my eyes.
So what about your week, Carl? How's things gone this week for you?
Yeah, good. Again, just inundated with the new consultations and people a little bit peeved they've had to, not us, but peeved they've had to wait for sort of dentists' practices to open back up again. I think that's been their biggest gripe.
Yeah.
It's not a massive gripe, but it's one that they've had to kind of suffer, be the right word to use, really. I mean, a lot of them are still coming in with what we would have seen and dealt with really early on, simple extractions where they've got fractured roots and they've been eating in discomfort, or failing dentition where the caries has sort of been left for a few months and they've got high caries rates. So I've seen a few of those. And just neglected, really, in terms of that it's not supervised neglect, because you can supervise it. Yeah. But it's neglect from, I'll put it very politely, from the government and the authorities that haven't allowed us as dentists to do our jobs and look after the patients. Thankfully, nothing serious, so I haven't seen any lesions that I've been worried about, and I hope I don't. But that's obviously one worry that I joined a new group, which is the British Association for Private Dentistry. At 20, you've joined it as well.
I have, yeah. Paid my subscription.
Excellent. And I do like where they're coming from, really, because I do feel that it's not angst and it's not anger or anything like that. I just feel that we've been kind of underrepresented, and we've got a voice, and I don't think we've been heard, not just as private practitioners, but as dentists. When it comes to a lot of the sort of unnecessary, I think it's necessary that we're regulated, but I think a lot of the regulations that I've been kind of put on top of, some of them are excessive and unnecessary, and they don't help patients. And I think the regulations should be there to help patients, not to hinder them. And so I hope these guys, and I think they will, are just going to continue to raise these concerns with the respective regulators and authorities. And I think they've done a sterling job with their letter that they sent to PHE, asking for a response to the unfounded regulations and the evidence-based regulations they are imposing, and imposing even more of if that Scottish, I can't call it evidence, I'm going to call it mythology. And I think unfortunately, I think that the people, as I mentioned a couple of weeks ago, the people that make these decisions, I'm old enough to remember the hospital assistants where you had a matron that kind of ran the ward rather than the managers running the ward. And the matrons kind of understood how it all worked because they had a clinical understanding, but they had a managerial responsibility as well. And they ran it really effectively because people listened to them and things were done extremely well. And I think once you've taken that clinical aspect away and you've just got this non-clinical aspect coming in without any kind of clinical input, or if the clinical input isn't coming in from people that are wet-fingered or on the ground, I think you lose touch.
I hope the dentists who signed up originally will get on board and pay their subscription and back it fully, because I think it developed legs quite quickly.
Yeah.
But I hope it continues to keep that momentum going, and obviously it's going to need some funding. Because these guys have put some serious time into it, haven't they? Really?
Yeah. I take my hats off to them. I thought I was a geek, but they take the geekiness to an exceptional level, and good, because they use it for us. And I also like the fact that pretty much anybody that has any links to dentistry can be a member and support the group and get support from the group. So there are some organisations out there that will remain nameless that will not have sort of dental auxiliaries and other members of the team, which are an essential part of the team within the organisation, won't represent them, which is a real shame. and it's caused maybe a little bit of splintering, and hopefully we can get some cohesion here, and a big voice. Anyway, that's my thought.
You shouldn't sit on the fence, Carl. You
Don't
really
Don't sit on the fence, did you say?
That's it. Yeah, don't sit on the fence. You know, we don't understand what you mean. Good on you. So we got Preston in lockdown again, I hear today. So
Is it really?
So
I didn't know.
So I hear. I mean,
Preston. Do you know?
No, I hadn't heard that.
Well,
no.
That's very interesting, because on the very first day of my time in Preston as a student, it was Sybil Roscoe who did the weather with Simon Mayo, and it was my first morning after college, and I flicked the radio on, and Simon Mayo came on, and the weather forecast came on, and it was sunny. The weather forecast was sunny throughout the country, apart from Preston. And I thought, what? Bearing in mind, sorry, Preston, but I'd never heard of you before I actually got into college there. And the great thing about that place was that I'd come back from my holiday in where had I gone? Faliraki, before Faliraki was like it is now. It was different then. It only had 2 nightclubs, and one of those was gay. And I ended up in that one, and with me mate looking around, going, "That's nice. Not a lot of women in here, but there's a lot of men dancing with each other." Starburst, I think it was called. But it was the only one that stayed open until 2 o'clock in the morning, otherwise you had to go to set. Anyway, I digress. So I got a tan. I had a little bit of a wispy tash, not quite as good as this. Got off the train. Thought I'll read a paper while I'm, sitting down waiting for time college. And it was a bank robbery that had happened. And the person that had robbed the bank had a tash and a tan. I think, what?
Were all the old ladies staring at you?
Yeah. So they'd abducted the NatWest manager's family and him, and then took him to the bank. And I think he was all right, his family all right, but they made him open the safe and took the money. But anyway, Preston, yeah, I didn't know that.
Well, apparently so. I mean, I'm sure it will be
first motorway in the UK.
Preston, well, the other thing is, you don't know. Kind of people are trying to decide which country they can go to.
I know.
Which, might be safe, and then be able to get back from and not have to quarantine for however long.
I struggle with it, and it's kind of like trying to get some kind of logic to the instructions or the guidance that we're being given. So I think we talked about last time. So Spain, you're suddenly in Spain, then you're told that you've got to quarantine for 14 days when you get back. But if you can't go to Portugal, but Portugal's got a lower case. And I think we talked about this last time in Spain. And I think, okay, there must be a reason. I just, it's the same reason that they kind of make up that let's describe a horse with a camel kind of thing, maybe. And then you hear of these other countries as well, and you think, and then you can go into a church as long as you wear a mask on the 8th of August. So you've got another week. It's not like we haven't got time to prepare to get masks ready or anything like that. And it's kind of like, why are you delaying it? Why can you go in for the next 7 days, but on that day, I just can't quite get my head around some of the lack of the cohesion of the guy. And if you do go into a shop and you're not wearing a mask, they've decided that they're not going to legally enforce it in certain shops. So you can do it, and you just get people might look at you and go, like the British do. And what they don't do anything other than go home and go, do you know what? I went to Sainsbury's and this twat wasn't wearing a mask. So I stayed more than 2 meters away from them. And that's about as bad as the British get, isn't it? You don't really see them like in America, where they get a gun.
Well, not yet.
Yeah, well.
When do you think we will or won't find out if there's any sort of transmission in dentistry?
Do you know what? I think that's a great question. And I wish, Will, I actually did some research and asked them sensible questions rather than just ranting. I know
talking about Preston and nightclub Faliraki.
So, it is good that Kate and you are on here.
Interesting, actually.
Yeah. And I think we've got to wait from the data to come around. So they are looking at testing again in 3 months after the first test, the cohort. So I think that probably if they do that, they follow up with that, and other sort of universities or trusts follow up with that kind of testing of health professionals, dentists and other health professionals after we were allowed to reopen again, and then have a look at the 2 sets of data. So there's going to be one in lockdown, and then there's going to be one after lockdown, and have a look at whether there's any difference between the two. That might give us some kind of idea. But the only sort of, I guess the only differential factor that they can look at there will be the wearing of the mask at the consultation stage, because the idea of the aerosols and the respirators, that's a much more difficult one to measure, because you've got so many confounders coming in, because we were working face to face when we were chatting with the patients prior to that, and we were wearing a mask when we were doing, well, most people I would imagine were wearing a mask when they were doing crown preps. So it'll be interesting to see whether there is a difference. And sadly, what I actually hope is there isn't.
Yeah.
Because what it would say was that at the beginning, what we were doing worked. But I imagine there might be a little bit of a difference, and that's probably due to the fact that we are sort of doing all this social distancing. So I think it's difficult. It's going to be a difficult one. Does that answer your question, by the way?
Well, I don't know, because there's certain things like to do with the exposure where you're saying, well, how transmissible is the virus if I have it and I'm just speaking to you and having a conversation? Is it going to, or do I need to actively sneeze or expel something from the back of my throat, or is it just floating in the air as I speak to you?
Yeah, I mean, well, the evidence doesn't suggest that it's hugely transmissible unless, one, you're showing symptoms. So I think the triaging of that, and I think that most people that prior to lockdown that were having symptoms didn't really come in, because you know, most patients are quite nice, and if they had a cough, the problem was the staff. No, you know, well, I'm coming in because
the boss is making me.
Yeah, and they probably didn't think it was, you know, that infective. I mean, it wasn't really understood that well, really. I'm racking my brains. My brain's not that good anymore, but I don't remember people panicking that much if you had a cough in, you know, December, January, and us understanding it that much. It was only kind of when it got sort of February, March, I'm thinking, you know what, when people are coughing there, you kind of
I know.
I guess it's all got to come out at some point, because obviously there's so many people who are symptomless. So can you get it from a symptomless person? I presume you can, obviously, because it's spread around quite a lot. But, you know, for me, getting my head around, you know, what actively has to happen for that number of virus particles that are going to have an effect to hit me through whatever mucosa of whatever shape or form, and then cause me to be ill. You know, I still haven't quite got my head around that bit of the science.
Do you know, I'm kind of with you on that. I wonder if for me, it's curious as to exactly how it is. And I wonder if it's the persistence of its ability to live outside of the respiratory system. And then we touch it and we get the passing, because we do touch our face and our nasal areas, because I certainly know that I do, and now I'm rubbing this little fella quite a bit.
A beard stroking in contemplation.
And you know, the washing of the hands, and I wonder how, you know, effective that's actually been in reducing the transmission rates of it. And the droplet side of it, the coughing and I'm not convinced that's a major spreader. And I think if it was, in my head, then when people were going around the supermarkets during the lockdown process, and they were walking around those supermarkets, whether they were aware that they were infected or not, it just doesn't add up that there wasn't that sort of exponential growth of the continuation of the virus. It kind of doesn't add, the maths doesn't add up.
I'd like to know what the sort of illness rate of staff in shops is, because that was the one area where shops were still open and people were still visiting, and just whether there's been any spikes within supermarkets, people going ill and being tested and showing positive. That would be, again, interesting stats, wouldn't it?
I'm 100% with you on that. What I really like, I don't know whether we talked about this. We might have done, or I might have just been ranted to somebody else. But it's, do you know, and I take my hats off to everybody that worked and still works in the supermarkets and the other shops, and put themselves out there to stay open. But it's the people that are on the tills with the gloves, and you're coming along with your fruit, your veg, and whatever else you've got, and they're putting it through the till. And because we're clued up on cross-infection and taking the gloves off and washing our hands, and I'm watching them, and I've watched them do the person in front of me, and I've watched them wear the same pair of gloves as my food goes through, and I've watched them not change those gloves when the next person's stuff goes through. And I'm thinking, well, if it is these little droplets, well, that's passing it from that potentially infective person that might be at number 1 or number 2 or number 7 or number 12 or number 99 that's gone through that till today, and then spreading it to everybody else because it's on that shopkeeper's gloves as they're moving it around. If that's how well this thing spreads. So that was one thing that I was intrigued about. And then the other thing, exactly that, what you said, Will, is shop, people in those shops and how poorly that they've been, and how many of their employees.
Talking of gloves as well, I believe these are going to be the new items that we're all trying to get, and prices going through the roof, I'm hearing. Just because, one, they are obviously in quite high demand. Everyone seems to be wearing, the rubber gloves or the nitrile gloves, and whether some of the supply chains in certain countries where, I don't know, whether it's whatever chemicals they're using is becoming in short supply. So again, this is just a rumor that I've heard. So I think in back of my mind is thinking it might be worth just making sure, one, you've got a good supply of gloves, or the practices you go to have got a good supply of gloves, and also maybe the protocol for what sort of gloves you can wear during a checkup, or your nursing staff and that kind of thing during a checkup, because literally they're getting through so many, like in our place, so many boxes of gloves.
Oh yeah, 100%.
So you're talking about the non-sterile sort of nitrile, normal, everyday stuff. Do Michael Jackson, just do your checkups one handed.
Just wear one white one with
white one.
Sparkles on.
Yeah, little sparkles on. I wasn't aware of that. That's interesting.
Doesn't surprise me, I've got to be honest.
It doesn't surprise me. It doesn't surprise me at all.
No. So should we get winter gloves out, Will? I mean, we joke. Might get my little mittens.
Little ski gloves on.
Reusable marigolds.
Ones. Yeah.
Are they autoclavable, those marigolds? They seem pretty indestructible to me.
Yes.
And you don't get that sort of sensitivity with them, but what the heck.
Well, I've come up with a plan. Is what you do is you go to the petrol station and you steal all the ones.
Great idea.
That they've got. I didn't say that. But
great idea. That's that
is in the know. Will Murphy's in the know.
That's just genius. Just genius.
So everybody's going to rush after this.
Do not support theft in any shape or form.
Well, they do around here.
We're all going to go and fill our cars up after this, Will.
If you got a car.
Well, if you've got a car.
Just check. Yeah, it's still there. Scumbags.
Right, gentlemen, with that in mind, we're 40 minutes in. So if we want to call it a night, I suggest we do so now before we are heckled with rumbling tummies.
He's getting angry.
Where
are you? Where are you going, by the way?
La Plancha in Moseley.
Oh, beautiful. Is that the Moroccan
tapas
on
the high street?
I've been there. Yeah, that's
yummy.
yeah,
Everybody's
delicious.
going to rush there now after to see Will
Yeah.
Murphy
Oh, no,
with
don't
all
do
the
that.
gloves.
Oh yeah,
I'm
go
gonna
on,
put on
go
all
and
that weight that I've lost in the surgery.
oh, it's gorgeous. Do you take your own wine in on that one? Is that the way you can take your own wine in, or?
No, I think is that the Moroccan one round the corner.
Could be. Do you know what? It's that long since I've been allowed out of the house, mate. I can't remember.
Right. On that note,
Yeah,
everybody, thank you very much. Have a fantastic weekend and see you next week.
Cheers,
Have a lovely
everybody.
evening, Will.
Bye.
Bye-bye.
Bye-bye. Thank you. It is.